Dr. Nitya Ramurthy, Senior Obstetrician Gynecologist, Fortis Malar Hospital, Chennai. So today's topic will be small for date babies, or otherwise said as growth restricted babies or small for gestational age, but we commonly say small for date babies. So in India, generally at term, the birth weight of the baby will be about 3 kgs. But yet, 1/3 of the population babies deliver at 2 to 2.5 kgs. So now we must find out why these babies are being delivered at such low birth weight and the reasons for it. So the more common, but these babies, though they are small for date, but physically they are normal and there's no neurological deficit in them. So they are perfectly fine. It's just that the birth weight is less. So what are the reasons? So the reasons can be something to do with the mother, baby or placenta. So we take the mother. Generally it could be genetic. Probably both parents are small made. So that is why the baby. Secondly, people living in hilly countries where the oxygen concentration is high. So in such cases also the babies are tendency to be small compared to babies born in the plains. The third thing can be nutrition. Sometimes the mother can be a poor eater, those nutritious food, but she may be a poor eater. So she starts off pregnancy with a less weight. And during pregnancy, she may not be eating properly. So that could be a condition. So another factor will be socioeconomic, poor socioeconomic status. Then otherwise, mother's health problems like anemia, hypertension, pregnancy-induced hypertension, diabetes, and collagen disease like SLE. Or she can be having associated health problems like cardiac problem or a respiratory problem or recurrent urinary tract infection. All these conditions will definitely affect the baby because the mother's health problem, the food, nutrition to the baby and oxygen for the baby becomes less. Hence the growth of the baby becomes less, and also LICA also has a tendency to become less. The other condition can be drugs or it can be due to heavy smoking. Then we come to the baby. The baby chromosomal aberrations can cause congenital anomalies, or torch infections can affect the baby like rubella, toxoplasmosis and cytomegalosis. They can cause congenital defects. Then in case of monochorionic twins, these twins share the common blood circulation, in which case one baby becomes bigger than the other, which is called Steele syndrome. And another most important factor is with placenta. Placental circulation can be poor. There can be placental infarct where the blood circulations are less. So thereby food carried to the baby becomes less and baby's growth also becomes less. Then how do we identify this? You know very well, around the 3rd month, when we do the double marker, in that when we do NT scan and down screening, one test will come as PA-PPA. When the PA-PPA, they will say that it is reduced. That means it's a warning sign to the obstetrician that this baby's growth is getting affected. So hence it wants us to start low dose heparin, low molecular weight heparin, or you can start blood thinner. So thereby we can prevent it very early itself in the first trimester. Then the other thing is we have to, the other factors we see the weight gain of the mother. If there's no weight gain, the weight gain is poor, even that would suggest that the baby's weight is getting affected. The third thing is when we make her lie on the couch and examine. For instance, she is 30 weeks pregnant, but you see the fundal height is less by 4 cm, probably 26 weeks pregnant. The fundal height is only 26 weeks. So in such a case, that also warns us, okay, baby's growth is becoming less and LICA is becoming less. Then how do I confirm this? I do an ultrasound. In ultrasound, we will see the BPD, that's the biparietal diameter, the baby's head circumference, and also the abdominal circumference and the femur length. In which case, okay, for instance, the mother has been not eating very well and the nutrition is bad. In such case, the baby's symmetrically the growth becomes less. Symmetric, right from the head onwards, the symmetrical growth is less. But in case problem arises around the 30th week or onwards, in such case, it becomes asymmetrical growth. Asymmetrical growth means what? The head is fat. From body downwards, the growth is less. In such a case, the baby in asymmetrical growth, when you deliver such a baby, you can feel the head is a little big, but you find that the abdomen is flat, and at the same time, the child has wrinkled skin because there is no fat below. So they describe it as an old monk look. So that's how it's going to be. Then another most important thing is we see is the child's brain. where the middle cerebral artery is seen for circulation. Sometimes the circulation is affected and it's called a brain sparing effect. At the same time, you see the umbilical artery. In the umbilical artery, there may be a notch or reversal of end-diastolic flow. This is a very, very important sign saying that the baby's growth is getting very affected. So these are the conditions. Now, how am I going to manage such a situation? So we explain to the patient the seriousness of the problem, and we ask her to take rest, ask her to have a good diet. If she has hypertension, pregnancy-induced hypertension, with the help of a physician, we'll stabilize the BP. In case she is diabetic, the diabetologist helps to stabilize the diabetes. In case she has SLE, then SLE she'll have to take low molecular weight heparin, aspirin, and there are other drugs like HCQ. All these medicines will be taken care. So the rheumatologist guides us how to take care of this. So we always have the help of these specialists. In case she has recurrent respiratory problem, the pulmonology plays a vital role. And also recurrent urinary tract infection also. In such cases, urinary tract infections, urine cultures done, ultrasound the kidneys are done, and also nephrologist guides us how to help them so that the baby's growth is good. So in all these aspects, being in a corporate hospital, this multidisciplinary approach helps us to save the baby. So this is how you would do. Then another important, in spite of giving low dose aspirin and also low molecular weight heparin is given, in such condition we also give 2 doses of injection steroids, 12 milligram, 48-hour interval apart. Why do we have to give steroid? This is to improve the lung maturity. So when the baby comes out, the baby cries well. So we have managed everything very well. Then how do I do a follow-up? In the follow-up, when she comes, we will see the baby mother's weight, and also we'll examine the fundal height to see whether the fundal height there is no discrepancy. Then we'll do an ultrasound to see whether the Liker is fine, the baby's weight is fine, and also the Doppler study of the umbilical artery and the middle cerebral vein is done. At the same time, we have sent them to the labor room where the patient is connected to the cardiotogograph. And then for half an hour, we will see the baby's movement. Not even an hour, I would say for 1 hour, we'll watch the baby's movements and also the heart rate. There should not be any deceleration in the heart rate. So all this, how we monitor them. So then let's see, everything is fine. Patient is stable, so is the baby. So at strict monitoring, I mean, we have to do weekly checkup and weekly NST and also ultrasound. Everything progresses very well. Then we allow her to go till 37 weeks and then we will induce the baby. In case you find that there is no weight gain, and also the ultrasound says there is no baby's weight gain, Liker is diminishing, and also there's a brain sparing effect in the middle cerebral artery, there's a notch, there's a reversal of blood flow, fine. And also when we send them to the labor room to do cardiotogograph, we can see deceleration of the heartbeat. Movements are very less, not hardly pick up 2-3 movements. So in all these conditions, it warns us that you have to terminate the pregnancy. So since we have given steroid, everything has been done. So since there's a warning sign, so we have to take the baby out. So the goal of this whole procedure is to save the baby. So now I want to stress to you that your proper antenatal checkup is very, very important. If you have associated comorbidities, they have to be stabilized. We must watch the fetal movements 1 hour after every meal. Have a balanced diet. Keep in constant touch with your doctor because it's like high risk pregnancy. And delivery has to be conducted in a tertiary hospital or in a corporate hospital where all specialists will be there to attend on you other than the obstetrician. And also make sure you take care. And I hope you like this topic. Till we meet again, have a great day. Bye.